Bismillahirrahmanirrahim. Assalamu alaikum. Myself, I hope you all are fine. I am Aksafzal, roll number is 84052, and the topic of my seminar is hypoxia. Now, here is the list of contents that I am going to explain with you about the hypoxia. First of all, we see what is the hypoxia. Hypoxia is derived from the two words hypo and oxia. Hypo means less than normal and oxia oxygenation. So it is a condition that mostly happens when there is a below than normal level of oxygen in the tissue of the body. Hypoxia can also happen even when the blood flow is normal. If we see the hypoxia in the medicine term, it is the condition in which the body or the region of body is deprived of the adequate oxygen supply at the tissues levels. Now, hypoxia versus hypoxemia. So, sometimes people confuse that the hypoxia and hypoxemia are the two same things, but these two are the not same things. These are the different things. Like as the hypoxia is the low level of oxygen in the tissues of your body, and whereas hypoxemia is the low level of oxygen in the blood. Sometimes both the hypoxia and hypoxemia occur together, but not always. Okay. Next is the classification of the hypoxia. Hypoxia may be classified as the generalized hypoxia and local hypoxia. The hypoxia may be generalized when it affects the whole body, and when the hypoxia affects the specific organ or the area of body, it is the local or the tissue hypoxia. Next is the types of hypoxia. There are the different types of hypoxia, or basically the reasons due to which there is not enough oxygen in the tissues of a body. So mostly we divide the hypoxia into the 5 types: hypoxic hypoxia, anemic hypoxia, stagnant hypoxia, histotoxic hypoxia, and metabolic hypoxia. So now we explain them one by one. What is the hypoxic hypoxia? It is the type in which the oxygen pressure in the blood going to the tissue is too low. Next is the anemic hypoxia. It is the type in which the amount of functional hemoglobin is too small. Stagnant hypoxia. In this type of hypoxia, the blood may be normal, but the flow of blood to the tissues is reduced. Next is the histotoxic hypoxia. In this type, the tissue cells are poisoned and unable to make the proper use of oxygen. And the last one is the metabolic hypoxia. This type of hypoxia mostly occurs when there is a more demand for oxygen by the tissues than the usual. Okay. Now there is types of hypoxia and their explanation, and now causes of hypoxia. Okay. The causes of hypoxia means the reasons due to which hypoxia may be caused. Like hypoxia may be caused by the lung damage due to trauma. Which is trauma? Trauma is a physical injury, okay, due to the certain lung diseases like COPD, due to the strong pain medicines, due to heart problems. Anemia. What is anemia? It is the low level of the red blood cells due to cyanide poisoning. What is the cyanide poisoning? Cyanide is a chemical which is used to make the steel, etc. Okay, the hypoxia may also caused by the lack of atmospheric oxygens, obstruction of the airways, and the inability to use the oxygen. These are also the causes of the hypoxia. Now, next is the signs and the symptoms of the hypoxia. So, here are the following are the signs and the symptoms of hypoxia. First of all, tachypnea. What is tachypnea? It is an increased respiration rate. Next is the dyspnea. It is the shortness of the breath. Next is the use of accessory muscles. Means when the patient was using neck or the intercostal muscles while breathing. Okay, decrease oxygen saturation level. What is the decreased oxygen saturation level? Means the normal oxygen saturation level, the oxygen saturation level which is considered normal is 92%, 92 to 98%, but when it is below the 92%, then it is considered as a decreased oxygen saturation levels. Okay. Next is the noising breathing, the audible noises with breathing. Okay, skin color of the patient. The skin color may change, the patient's skin color may change to bluish or the gray color are also the sign of hypoxia. Okay, position of patient means the patient was not able to lie flat on the blood when he was in the hypoxic condition. Okay, change in mental status or LOC. What is LOC? It is the loss of consciousness, and this is the worsening and the late sign of hypoxia. And restlessness or anxiety, these are the early signs of the hypoxia. Okay, next is the response of cell to hypoxia. Okay, how the cells respond to the hypoxial condition. The cell respond and adapt to hypoxia by increasing levels of the molecule which is the HIF, hypoxia inducible factors. Under the normal conditions, VHL protein bind to the HIF and marks it for the degradation. In the low oxygen level, VHL is not modified and not bind to HIF. As a result, the HIF persists. HIF is the hypoxia inducible factor. Okay, so cell respond to hypoxia by increasing level of HIF. A protein VHL make chemical modification and bind to HIF. Low level of oxygen level, result HIF persist. Elevated HIF level enable cell to survive and proliferate. Persistent HIF activity result diseases like cancer, etc. Okay, hypoxia and drug resistance. The hypoxia can be the direct cause of the therapeutic resistance, as some drugs and the radiation require oxygen to be maximally cytotoxic. Direct cause of therapeutic resistance, cellular metabolism is altered under the hypoxic condition, and hypoxia can result in the drug resistance indirectly, and hypoxia can enhance the genetic instability in the tumor cells. Okay. Next is the hypoxia and hypoxia inducible factors. So, by activating relevant gene expression through hypoxia inducible factors, hypoxia can increase the tumor glycolysis. Angiogenesis. What is angiogenesis? It is a physiological process through which the new blood vessels form from the pre-existing vessels. Survival response. It is basically the fight or the flight response, and the invasion and the metastasis. So invasion refers to the direct extension and the penetration by the cancer cells into the neighboring tissues. Okay. Now next is the approaches to target the hypoxia and the hypoxia inducible factors. So there are several approaches by which we can target the hypoxia and the hypoxia inducible factors. There are multiple approaches to target the hypoxia and hypoxia inducible factors, like hypoxia inducible factor inhibitors, hypoxia activated bioreductive products, and the gene therapies that becomes the effective treatment to prevent or reduce the metastasis. Okay, next is the hypoxia responses in the renal tissues. That how hypoxia respond in the kidney. Okay, how kidney respond to the hypoxia. So what is the role of the kidney in hypoxia? The kidney play an important role in this process, as it is the main physiological source of the EPO in adults. What is EPO? It is the erythropoietin hormone. When there is a lack of oxygen, it is detected by the nephrons of the kidney. When the blood enters into the kidney for filtration, it also carries the red blood cells. In response to the hypoxial condition, a hormone is released from the kidney, as hypoxia condition is detected by the nephrons of the kidney. So in response to hypoxia condition, a kidney releases the hormone which is the erythropoietin. It is the glycoprotein hormone. The erythropoietin, when released from the kidney, it stimulates the formation of RBCs, like we can see in this mechanism. Okay, hypoxial condition, it is detected by the kidney. Kidney then secrete the EPO, and the EPO then target the bone marrow, and the bone marrow then secrete the red blood cells and enhance the production of the red blood cells. Okay, so the erythropoietin released from the kidney, it stimulates the formation of RBCs, and it can activate the mechanism of RBCs formation in the bone marrow. So hypoxial condition is detected by the nephron of the kidney, and the kidney then releases the EPO in the circulation, and EPO then target the bone marrow so that the synthesis of the RBCs is started. So role of kidney. The kidney increases the synthesis of EPO, stimulation of red blood cell production, and these are regulation is done by the hypoxial inducible factor 2, not by the hypoxial inducible factor 1. Okay. Next is the brain damage. Like these are the severe effects of the hypoxia. The hypoxia may be sometimes so severe that it can also affect the brain, and the death of the person may also occur. Okay. The brain damage can begin within the minute or the two of the total oxygen deprivation. After the 5 minutes, death of the brain cells and the severe brain damage that become inevitable. And some people, okay, so let's see that most people will die within the 10 minutes, and the poor health people, like the people who are already resistant to some diseases, are often die much sooner. And some people may also suffer other medical catastrophes such as heart attacks in response to the oxygen deprivation. So hypoxia can be so severe that the death of the person may occur. Okay, and it can affect our brain, and brain damage may occur due to hypoxia. So next are the safety considerations. Consider the underlying cause of the hypoxia, such as the COPD, heart failure, anemia, pneumonia, that all need to be prevented and manage the hypoxia. Okay. Next are the complications. The hypoxia can be sometimes more complicated, like it can cause the complications like the breathing difficulty, like the deprivation of essential component from the blood. Okay, so hypoxia can be so complicated that it can cause a diseases like COPD. Like what is COPD? It is a chronic obstruction pulmonary disease. Hypoxia can make the breathing difficulty, and it can affect more than lungs, means it can affect other body organs than lungs, and the vital components may also deprive from your blood, and the body was not able to carry out the basic functions. Okay, next is the hypercapnia. It is also the complication of hypoxia. Okay, so the hypoxia can lead to the condition which is the hypercapnia. This condition may occur when the lungs retain too much carbon dioxide due to the breathing difficulties, and this may increase the carbon dioxide level in your blood stream that may be deadly. Okay, so it is the complication in hypoxia, and in this complication there is too much carbon dioxide in the lungs, and this elevation carbon dioxide level into blood stream, and it can be deadly. Okay, so there are also some other complications due to the hypoxia. Untreated chronic COPD. What is COPD? It is chronic obstruction pulmonary disease, may lead to other complications like depression and other mood disorders, fatigue, headache, high blood pressure, pulmonary hypertension. What is pulmonary hypertension? It is the high blood pressure in the blood vessels that supply to the lungs, increased heart rate, heart failure, acute respiratory failure, and secondary polycythemia. It is the increase in the red blood cells mass that is caused by the enhanced stimulation of red blood cell production. When the production of red blood cell is enhanced too much, then this condition may occur. Okay, next is the diagnosis of hypoxia. The hypoxia can be diagnosed by several methods, like we can use the method of pulse oximetry. What is pulse oximetry? It is a test that is used to measure the oxygen level in the body. Okay, so what is a pulse oximetry? It is a test that is used to measure the oxygen level of the blood by determining the oxygen level in a blood gas sample, by performing the other test, by using performing the pulmonary function test, and the normal readings are about 94% to 99%. Okay, next are the tests for the hypoxia. So some tests that may be done if the patient have the hypoxia include the oximetry. What is oximetry? It is an easy painless measure of how well oxygen is being sent to the parts of body by performing some blood test, by using the ECG, X-ray or CT scan, bronchoscopy. What is bronchoscopy? It is basically a procedure that allows a doctor to examine the inside of the lung. A doctor insert a thin tube containing a light and a camera into the lung through the nose or mouth and test for hypoxia, MRI and echocardiogram. Next is the prevention. Okay, hypoxia can be prevented by several measures, like avoid the circumstances that reduce the oxygen concentration by providing oxygen via nasal cannula or oxygen mask before hypoxia develop, by recognizing those individuals who have tendency to develop hypoxia, using medications that can provide prevention. Okay, next is the treatment. Hypoxia must be treated immediately. So there are many types of treatment for hypoxia, like we may use an inhaler or asthma medicine by mouth. We also can give them injection or medicinal hypoxia in a vein through IV. Okay, a steroid drug may also use for a short time. We also use antibiotics to treat the underlying infection, and sometimes a machine is also used that help the patient to breathe. Okay, so oxygen therapy, it is a common method for providing the extra oxygen. It is also called the supplemental or the prescribed oxygen. In this method we use a mechanical device that supply oxygen to your lung, and the supplement oxygen can reduce the shortness of breath, and it can decrease the hypercapnia, which is a complication of hypoxia. Next is the medication. So beside oxygen treatment to treat hypoxia, there are medications like we can use several types of medication. We may use the blood pressure medication that reduces swelling. We may use the heart medication that control the heart failure. Also use the heart medication that control the chest pain, and we also use the allergy medications. Okay, so aside from the medical treatment, it's important to stay away from the environmental triggers, like we may also avoid smoking, also avoid the secondhand smoke. What is the secondhand smoke? It is a smoke that is involuntarily inhaled by others, and we also stay away from the air pollution, and also stay away from the chemical or the dust in the air. Okay, so here are some references from here. I have taken my data. If you person have any question, you are free to ask from me. Thank you so much.